I'm John Silcox with the Fairfax County Health Department, and I'm pleased to bring you today a little bit more information about Zika virus. You may have been hearing about that in the news and seeing information about that as the summer has gone along. Today with me is Andy Lima with our Disease-Carrying Insects Program and Barbara Downs, who's an epidemiologist here at the Health Department, and they're going to talk a little bit more about Zika, what it is, how we're approaching Zika this summer, and what you can do as a resident here in Fairfax County to protect yourself and reduce your risk for Zika and other mosquito-borne illnesses. So with that, Barbara, do you want to start telling us a little bit more about Zika?
Absolutely. Thanks, John. So today we'll be presenting Zika virus disease and prevention. In today's presentation, we're going to give you an epidemiological overview of Zika virus, and then we'll be finishing up with our mosquito bite and prevention and control messages. We'll start off with a little history. So each day we're learning more and more about Zika virus disease and its implications. So today we'll be talking about what we know and what we hope to learn in the future. Zika virus disease was first discovered in a monkey in 1947 in the Zika forest in Uganda, but it wasn't until 5 years later, in 1952, that the first human case was discovered. Throughout the years, we've had outbreaks in the Africas, Americas, and Asia. And as you can see from this slide, a brief history is that Zika virus is relatively new term to us, because we're talking about it for the last 6 months, but not necessarily new to the world. This is a map from the CDC of current countries and territories with active Zika virus disease transmission. This map is updated every time we have a new country or territory added to the list. So we really highly suggest that you check out the cdc.gov website to get the most up-to-date list of Zika-affected countries. So how is Zika virus disease transmitted? It's primarily transmitted through the bite of an infected Aedes aegypti or Aedes albopictus mosquito. We've also seen transmission through pregnant women infected with Zika who can pass Zika virus to her fetus during pregnancy or around the time of birth. Zika has been documented as being sexually transmitted, and there is a strong possibility it's passed through blood transfusions. The most common symptoms of Zika are fever, rash, joint pain, and conjunctivitis, or red eyes, as seen in this infographic. The time frame from exposure to symptoms is 3 to 14 days. There is currently no vaccine or medication available to prevent or treat. So the majority of people, about 80%, who develop Zika virus won't actually have any symptoms. So for the 20% that do develop illness, the clinical illness is usually mild. And because of this, when symptoms do occur, they last several days to 1 week. Since the illness is generally mild, most people, severe disease requiring hospitalization is rare, and death is also rare. Guillain-Barré syndrome is reported in patients following suspected Zika virus infection, and we'll talk more about that in the next slide. And once a person has been infected, he or she is likely to be protected from future infections. Guillain-Barré syndrome is a rare disorder where a person's own immune system damages their nerve cells, causing muscle weakness and sometimes paralysis. Symptoms can last a few weeks or several months, and most people fully recover, but some have permanent damage and in rare cases have died. Guillain-Barré syndrome is very likely triggered by Zika in a small proportion of cases, just as it is from a variety of other infections. The CDC is currently investigating the link between Zika and Guillain-Barré syndrome. What we do know is that Zika virus is a cause of microcephaly and other severe fetal brain defects. This is the first mosquito-borne illness to cause congenital anomalies. Microcephaly is defined by having a smaller than normal head or brain circumference. The prognosis varies depending on the severity of microcephaly, and Brazil has been reporting an increase in number of babies with microcephaly, and some have had lab-confirmed Zika. It's important to note here that not every pregnant woman who has Zika virus will necessarily have a baby born with microcephaly or any other fetal abnormality. So to learn more about the progression of Zika and its implications on pregnant women and their infants, the CDC has developed the U.S. Zika Pregnancy Registry. The purpose of this registry is to monitor pregnancy and infant outcomes following Zika virus infection. Included in the registry is pregnant women with lab evidence of Zika virus infection and their exposed infants born to these women. Infants with laboratory evidence of congenital Zika virus infection and their mothers can also be included. This registry is voluntary. Moving on to some Zika prevention strategies and for travelers to Zika-affected areas. So the CDC really breaks this into 2 groups. If you are pregnant or considering becoming pregnant, the CDC recommends that anyone in this category should not travel to a Zika-affected area. Additionally, if a male sexual partner travels to these areas, the pregnant woman or even the couple considering conceiving should either use condoms correctly from start to finish every time they have vaginal, anal, or oral sex, or abstain from sex for the duration of the pregnancy. This graphic is also available on the CDC website, and it goes over more specifically our recommendations when it comes to sexual transmission. For individuals with a possible exposure via recent travel or sex without a condom with a male infected with Zika, the recommendation is to use condoms correctly and consistently for women up to 8 weeks following that exposure, and for men who develop symptoms of Zika or are diagnosed with Zika virus to wait at least 6 months after symptoms start to abstain from sex and use condoms. For all other travelers, the CDC and the World Health Organization says it is safe to travel to a Zika-affected area, but we're asking that you pack to prevent. You bring your insect repellent, your long sleeve shirts, your long pants, your bed net, and your condoms. Avoid mosquito bites while there. If you're going to an area where you won't be able to sleep in a screened-in window or use air conditioning, bring your mosquito net and your bed net. Additionally, this last point is really very important because even if you don't feel sick, travelers returning to the United States from a Zika-affected area should be prepared when they return to prevent mosquito bites for 3 weeks. And this is really because when we talk about local transmission of Zika virus, we're talking about our mosquito population that's infected with the virus. And for a mosquito to become infected, they need to bite a person that's infected with the virus. So currently, we have no cases of local transmission in the United States. For our mosquitoes to become infected, they would bite an infected person. So that's why we're asking anyone that returns from a Zika-affected area to prevent mosquito bites for up to 3 weeks. The last bullet here is we highly encourage anyone that's traveling out of the country to a Zika-affected area or not to visit the CDC's Travelers Health website. There you can find information on travelers' warnings, as well as vaccine guidance and any other tips you need to traveling to that country for a safe time. So what are we doing here at the Fairfax County Health Department? We're happy to report that as of 11 a.m. this morning, there's no local transmission of Zika in Fairfax County or in the continental United States. Our communicable disease epidemiology unit is conducting human surveillance, so Zika virus is a reportable condition, and providers and laboratories are asked via the Code of Virginia to report cases to the health department. And our disease-carrying insects program is conducting mosquito surveillance. If either of these indicate an area at high risk for Zika transmission, the health department will conduct educational outreach and begin mosquito control activities. So at this point, I'm happy to pass it over to Andy Lima, our mosquito biologist in the disease-carrying insects program, who's going to talk more about those mosquito activities and mosquito bite and prevention.
Thank you, Barbara. My name is Andy Lima. I'm with the Health Department's disease-carrying insects program, and we're here today talking about Zika virus disease and how you can hopefully prevent it. So for my end, I'm going to talk about the mosquito bit and how you can prevent from getting mosquito bites and try to reduce your chance of getting a Zika infection. There's only 2 things you take away from my section today. Is that we want to do everything we can to prevent mosquito bites and eliminate container habitats around the yard, because these are the only places that our local Asian tiger mosquitoes are found that have the ability to transmit Zika. So we really do need your help, and thanks for your participation today. Mosquito life cycle lasts from about 7 to 10 days during the typical summer months, and it has 4 stages that are similar to the life cycle of something like a butterfly. There's an egg, a larva, a pupa, an adult. And there are different control measures that we can take at each of these stages, but most importantly, because of the length of that life cycle being weekly, essentially, by emptying standing water around the yard weekly, you'll eliminate this ability of this mosquito to emerge and hatch completely. Only our female mosquitoes drink blood, so those are the ones that are out and biting because they need the blood to be able to produce the eggs. There are 2 species that are known to transmit Zika, the yellow fever mosquito and the Asian tiger mosquito. Now here in Fairfax County, it's very rare that we see the yellow fever mosquito. This is the species that's driving the majority of the transmission right now in the Americas and the Caribbean. So it's a fortunate thing that we don't have that species very commonly here. But we do have in abundance the Asian tiger mosquito, which is an introduced species that came into the United States in 1985. And for the last 10 to 20 years here in Fairfax County, it's really ramped up to become the #1 nuisance mosquito that people see in their backyards. They are capable of transmitting these 4 pathogens, including dengue, chikungunya, yellow fever, and now Zika. But again, the primary vector of these is going to be the yellow fever mosquito, and it's really kind of unknown how well our Asian tiger mosquitoes will be able to transmit something like Zika. that they only develop in containers. So they're not going to be in stormwater structures or ponds or streams and creeks. They only develop in those container habitats. They do have a preference to feed on humans, but they will also feed happily on other types of hosts too. So it's not exclusively humans. And in doing that and having that more broad diet, that actually makes them a little bit less efficient than something like the yellow fever mosquito as a vector. They have a very short flight range, so they spend their entire lifetime in an area that's probably less than the size of a football field. So if you are getting bites on your own property, it's usually because you have containers there that are producing these mosquitoes or a nearby neighbor does. There are urban and suburban mosquitoes that really do well around human habitations, so you're less likely to see these if you're out hiking somewhere in the woods and more likely to see them if you're hanging around a household. They're most active during the daytime, which is unique for this species, but they still do peak at dawn and dusk along with a lot of other mosquito species. So dawn and dusk are really the times when you want to take those extra prevention measures to make sure that you're not getting bites. But since they are active during the daytime when it's often very hot outside, they're really looking for cool shaded places to rest, such as in vegetation, and that affects the way that we do our control for this species too. In terms of our preparation in Fairfax County, we already do a lot of education and outreach because we've been established since West Nile virus arrived here in 2002. But in doing things like this and developing a lot of different outreach materials, we're trying to really enact behavioral change in our citizens because that's the number one way that they can prevent mosquito bites and reduce their incidence for disease. In addition, our program does a lot of mosquito surveillance. We have 71 trap sites around the county, and we look at these weekly, and we test our mosquitoes for West Nile virus and for Zika this year too. So we have the largest trap network in the state, and we're able to get quick turnaround on our results to help enact our control decisions. For control of the Asian tiger mosquito, perhaps the most important bit is getting rid of those container habitats. We call this source reduction, or tip and toss, getting rid of that water. In addition, if there's areas that we can't get rid of the water in, then we would use something called a larvicide that actually controls and kills the mosquito larvae that could be developing inside for a period of time after the application, perhaps up to about a month or so. So that can be used on situations like a tire pile, or even individual things around the yard that you might not be able to empty, like a rain barrel or something like that. In terms of adulticide treatments, these are pesticide treatments that control adult mosquitoes. So we put down a barrier that essentially adds a residue to the plants and the vegetation where these mosquitoes are resting. And by doing that, mosquitoes that come in and land in those areas after the fact will contact that and be killed and provide control. So this is the main way that we're doing control for Zika this year as well. And this is different than what most people might typically think of, which is during the evening, a spray truck, driving through the streets and spraying that way. So it's a much more targeted approach that's at a smaller scale because of the short flight range of this mosquito. So if we get travel-associated cases, meaning that the person had traveled to a Zika-affected area and they come back to Fairfax County and are exhibiting symptoms of Zika, then we would, our epidemiological group, Barbara's group, would look into and get all the details with the provider, the medical provider, as well as the patient, and then they would transfer the address information to the disease-carrying insects program so we can go out, do additional education for the resident, do source reduction, that tip and toss action on their property, potentially using larvicides, setting traps to collect adult mosquitoes that we can test for things like Zika, and then if it's necessary, and if it's deemed by the surveillance, doing adult mosquito control treatments like I described. What we determine is local transmission. So if we detect local transmission, that means that our mosquitoes locally picked it up. So a person who doesn't have any travel history to a Zika-affected area, they've become sick, and it means that they likely got sick from a person who returned that was bitten by a mosquito, which then that mosquito bit the person with no travel history, and now we've got local transmission of Zika. In that case, we have to expand out a little bit. So we would perform our outreach and source reduction and larviciding and adult control as previously described, but we do it on a wider range, up to about 200 meters, which would cover the flight range of the mosquito, so that we can make sure we do those targeted applications and get the production of the adult mosquitoes that could potentially transmit that further. In terms of your prevention and protection, a big thing is doing neighborhood cleanups and what you can around your own yard. And this is probably the most important piece. So we really need you to share what you know and participate. By eliminating standing water around your yard, you're going to prevent this mosquito from being able to ever fly and bite. So checking your yard weekly effectively interrupts that life cycle like we talked about before. Tossing out that water, throwing away containers when you don't need them, or storing them in a good place where they're not going to be holding water. So whether it's turning over the wheelbarrow or turning over the wheelbarrow and putting it somewhere inside so that it's covered up. And if you can't empty that water, then using a larvicide when you can. These are just some examples of different container habitats that we might see that you might not think about around your yard, but they are producing mosquitoes potentially. So things like potted plants, just a piece of trash there. This is a potted plant saucer at the bottom of a plant. And these can easily produce a large number of, potentially each container, thousands of Asian tiger mosquitoes in the summer. So just eliminating those things on your property is one of the most important things you can do for nuisance and for your Zika protection. Some more examples of containers here. Corrugated downspout extensions are a really important unseen one that we might not think of. So it's a good idea to remove these after a good rainfall and make sure they're emptied out, or put them in a way that they're angled so that they'll drain properly. These are all areas where Asian tiger mosquitoes are not typically found. So some of the places I was describing before, they can still produce mosquitoes, but mosquitoes are very species specific in the habitats that they select. And since Asian tiger mosquitoes only like containers, we don't need to worry about these other habitats in terms of Zika transmission. When it comes to treating your own yard with an insecticide, you want to focus on products that you can get even over the counter at a hardware store that can hook up to the hose and that provide a residual like we talked about, that stay on the vegetation for a while after the initial treatment and continue to provide control. Dressing to protect just means covering up. So wearing your long sleeves like Barbara talked about if you're traveling, but even locally here, wearing long sleeves, long pants, good socks and shoes, and light colors. Light colors are less attractive to mosquitoes. And using things that have a loose fit, potentially treating your clothing with something called permethrin, which we'll talk a little bit more about. When it comes to repellents, there are 4 main active ingredients that are recommended by the Environmental Protection Agency and the Centers for Disease Control and Prevention. These 4 active ingredients are DEET, picaridin, IR3535, and oil of lemon eucalyptus. DEET is really the gold standard that we have for repellent. It's been around, it was developed 60 years ago, and we've got the most data on it. And it's the only repellent that we know also repels ticks. So this is really one of the best repellents that we have around as far as active ingredients. But the most important thing when you are using a repellent is to always read and follow those label instructions, because even though it might be tedious to read the fine print, it's going to tell you how to safely and effectively use the product. Reapply as directed, and if you are using sunscreen in conjunction with repellent, apply the sunscreen first and then the repellent on top. For children, a lot of these same active ingredients are also recommended for children and also for pregnant women too. So when it comes to applying repellents to children, we want to make sure that we're applying it to our hands as an adult and then putting it on the child's face, avoiding the eyes and the mouth and cuts or wounds or things like that. We also want to avoid the kids' hands because they might put their hands in their mouth. But these are products that are repellents that are approved for use on kids as well. So covering up the crib or stroller or the carriage when you're out will also prevent bites too. The use of permethrin on clothing is a really good way to prevent bites additionally, and permethrin is the active ingredient that you want to look for. So this is a product that's never applied to skin, but only usually applied to clothing, and you would put it on there, and it has the potential, if you apply a do-it-yourself formulation, to last for 6 to 7 washes or 6 to 7 weeks, depending on wash cycle. There's also clothing that you can get right off the rack from manufacturers that's impregnated with permethrin inside and probably lasts closer to 60 to 70 washes with permethrin. But this will actually contact and kill mosquitoes or ticks that can come and try to land and bite, and it also has some repellency as well. Avoidance is another important part. So we know that Asian tiger mosquitoes are active all day, but then we peak during dawn and dusk, so it's important to avoid those times when you can. And if you are going to be out at those times, taking those extra prevention steps. The use of air conditioning makes it harder for mosquitoes to get inside, and if they do get inside, they dry out quicker because it's lower humidity and cold, so they'll die faster in the house that way. If you do have the windows open, then intact screens are a must. You really want to have those functional so that we're avoiding the mosquito coming inside the bite. There's a lot of misinformation out there about Zika, but the good places to get information are places like the Pan American Health Organization, the World Health Organization, Centers for Disease Control and Prevention, Virginia Department of Health, and especially the Fairfax County Health Department webpage, where we've got a lot of Zika-specific information and a lot of our outreach materials available too that we've developed specifically for Zika, but also ones that have life beyond Zika, and a lot of these that we just had to modify from having done it with West Nile virus. So with that, that's my last slide that I've got, but we're going to bring John Silcox back up and Barbara Downs so we can just have a little bit of closing.
Thanks, Andy, and thanks again for watching today. We were happy to bring you this information about Zika virus prevention, and hopefully you found it helpful and educational. Please, if you have additional questions, always feel free to reach out to the health department. You can contact us directly by phone at 703-246-2411. You can contact our disease-carrying insects program if you have additional questions about mosquito prevention. You can email them at fightthebite@fairfaxcounty.gov. And I know one question that we did receive was how many cases in Fairfax County of Zika have there been? Please remember that we're only talking about travel-related cases in Virginia, as we've had no local transmission. And Virginia Department of Health reports Zika cases on a weekly basis on their website. They do that by region, not by county. So in the northern region, which includes Fairfax County, there have been 24 cases to this point. Again, these are travel-related, or in some ways, the case was a result of someone traveling to the affected area, so we don't have local transmission at this point. So with that, I just want to thank our special experts today, and thank you for watching, and have a great day.